Airborne isolation, N95 mask reusing education. This is temporary and until further notice. If you have a patient in airborne isolation, obtain your N95 mask. The CDC recommends using the N95 mask up to 5 times per unique patient, with instructions following. Also, per recommendations, keep the N95 mask in a paper bag to prevent moisture and contamination, and document on the paper bag that is used to track the usage of each mask. Discard the N95 mask in the following instances if contaminated with blood, respiratory, or nasal secretions, or any other bodily fluids from patients. N95 masks are to be discarded if utilized during an aerosolizing procedure. When performing aerosol generating procedures with the airborne isolation patient, also please decrease the number of staff in the room if at all possible. The process for using our N95 mask. The clinician can reuse their N95 mask for only airborne precautions. Process and reuse and storage. Once the patient care is complete, remove your PPEs, leaving the N95 mask in place. Exit the patient's room into anteroom or right outside of the patient's door. Perform your hand hygiene and don a new pair of clean, non-sterile gloves. Carefully remove your N95 mask, touching only the strings, and avoid touching the front of the mask. Place the mask inside of the paper bag, ensuring the strings remain on the outside of the mask. Remove your gloves and sanitize your hands. Use a new paper bag each time you store your N95 mask and document on the bag the current number of use with your name and the date. Store the bag in the anteroom or designated location. Discard your N95 mask after 5 uses or at the end of every shift, whichever comes first. Use a pair of clean, non-sterile gloves when donning a used N95 mask and performing a user seal check. Discard your gloves after the N95 mask is donned and any adjustments are made to ensure the respirator is sitting comfortably on your face with a good seal. Key points. Always clean your hands with soap and water or an alcohol-based hand sanitizer before and after touching or adjusting the N95 mask, and only touch or adjust if it's necessary for your comfort or to maintain the fit. Touch only the strings of the mask when donning and doffing, and avoid touching the inside of the mask. If inadvertent contact is made with the inside of the mask, perform hand hygiene as previously described. Gently bend the nose piece over your finger to approximate nose positioning. Cup the mask in your hand, allowing the bands to hang freely. Grabbing both bands with one hand, hold the mask under the chin with the other hand, and pull both bands over your head. Position one band under your ears and one band above your ears. Hold the mask in the desired position with one hand, properly form the nose piece with the other. Cup both hands over the mask, checking for tightness. Inhale sharply and negative pressure should be felt within the mask. Then readjust as necessary. Performing a seal for the N95 should be completed every time you place it onto your face. Place both hands over the respirator, take in a quick breath to check if the respirator seals tightly to your face. Place both hands completely over the respirator and then exhale. If you feel leakage, there is not a proper seal. If air leaks around the nose, readjust the nose piece as described. If air leaks around the mask edges, readjust the straps along the sides of your head until a proper seal is achieved. If you cannot achieve a proper seal due to air leakage, ask for assistance from a partner. In summary, the N95 mask is to be used for all airborne isolation patients. We now have the universal fit N95s available for use. Perform a seal test with each use. The N95s are to be used up to 5 times per provider per patient. Remove the N95 and place it in a brown paper bag. Label it with the name, date, and number of use of 1 through 5, and leave the bag in the anteroom or designated location.